160 cases diagnosed and 13 persons already dead in a cholera outbreak in Yobe State. 15 dead, 30 others in critical conditions as measles break out in Benue State. According to reports, about 30 persons are under surveillance for LASSA fever in ABIA State. Communicable diseases on the rampage, and the most affected are always women and children. What are the causative factors? These diseases Nigeria has continued to battle at one time or the other. So why the resurgence? How effective are the various responses to the outbreaks? And what should we be doing to safeguard lives? This is the focus on the program Nigeria Today. I am Segun Ojelade. You're welcome back. Grim statistics there, you will say, on the outbreak of cholera and measles in the country over the years. Now, I'm being joined in the studio by two medical practitioners. I have with me in the studio Dr. Adeoye Alabi. He is a family physician with the Alliance Hospital near here in Abuja. Doctor, I welcome you to the program.
Thank you very much.
I also have with me another medical practitioner, Dr. Ayo Ulusoya David. He is also, like I said, a medical practitioner with the Nigerian Television Authority, NTA headquarters. I welcome you to the program.
Thank you very much.
Now, Dr. Alabi, we have an outbreak of measles, and then we have cholera. It's been a recurring problem. What actually must have gone wrong that these diseases keep recurring?
Well, first and foremost, we need to go back to what are some of the basic things we need to know about these diseases. And there are some things that we need to do in order to curtail or to prevent resurgence of these diseases. And where they are not being done, obviously we are going to have resurgence. Let's take example of cholera. We all know that cholera most of the time is actually through contamination of whether the food or the water that people drink. So it means that whenever you have contamination of these two materials and people take them, cholera will result. So in a way, whatsoever we can do in order to make sure that there is proper sanitation, the type of water that people drink is safe, and the sewages, feces are being properly disposed the way they should, it means that there won't be recurrence or resurgence of these illnesses. As long as these basic things are not being done, for example, on the part of the government, if the willpower is not there to do what it's supposed to do, we are bound to have resurgence. Well, for example, like measles, we all know that measles is actually a vaccine-preventable illnesses, especially in under 5 children. So we expect that children should be vaccinated the way they should. Now, if the vaccination is not done in some places, or maybe due to some economic reasons, or maybe sabotage, it could be any factor. Measles are not being the way they should, or maybe even in some places, maybe religious reasons, or maybe there are some people with taboos. Some people may think that maybe by taking their children to vaccination, something else will be introduced to their body. So they won't take their children for vaccination. We're bound to have recurrence of all these or resurgence of all these diseases.
Now, let's look at where we are having outbreaks now, mostly in IDP camps. Now, against the backdrop of what Dr. Alabi has said, the peculiarities of this area and the diseases, it's like we can't but have it.
Yes, very correct. Just like he said, these diseases have one thing in common. They spread very fast, and they are more proliferated in places where you have overcrowding. Now, most of these places have very poor infrastructure. Sanitation is poor. They don't have proper toilet systems. They don't have proper water running, you know, things like that. So for them to actually live a normal life, just like Dr. Alabi said, disposing their feces normally, it's impossible. Now, this enhances transmission of either cholera or measles or any of these diseases. When you have a lot of people packed in one place, measles, for example, can be transmitted by sneezing. I'm close to you, you're close to me, we sleep in the same space, maybe 10 in a very tiny room, and then someone sneezes at night with measles. It's very possible for a small child to catch such a disease. Cholera, same thing. Fecal-oral route is the most common mode of transmission. Most of them eat what they can find. So whether it is contaminated or not is not their problem. They just need to feed. Most of the time that food is contaminated, and then you have a very rapid spread of these diseases in overcrowded places like IDP camps.
Now, let's look at those that are mostly affected, like we said, women and children. How do we safeguard them in an environment like in our peculiar situation in Nigeria, where poverty remains ravaging, ignorance is very high? You know, how do we protect the vulnerable against these diseases?
Well, thank you very much. Well, just like I said initially, if we pick IDP camp, for example, we all know that the people that are there, they are vulnerable. And so to say, they are at crossroad because of what is happening at that point in time. Now, when we look at what we can do on the part of the government, let's take on the part of the government. Now, there must be adequate willpower in order to make sure that prevention or containing the disease is put in place. For example, when there is an outbreak like this, our preparedness, how we stem to action is very, very crucial in making sure that, just like what my colleague said, disease spread very, very fast. So it means that if you don't do what you're supposed to do on time, what happens? Disease continues to spread.
Yes.
More people will be affected. Now, for example, measles, we all know, just like what he said, is something that is spread through a droplet, is a droplet infection. If somebody is sneezing, somebody is coughing, and others are nearby, they can easily contact disease. It means that now, where the people are staying, the structure in which they are living, how is it able to make sure that they are not so crowded together? Ordinarily, we know that, you know, during a situation is an emergency situation, but government must still make sure that the way they are living, in the way they are not too crowded together. If they are too crowded together, there is no way somebody will not. If somebody contact measles, obviously it's going to be spread to the other person. And another thing government can also do is to make sure that now the people who have not contacted the illness, how are they going to get vaccinated on time? Like even in the case of cholera, the same thing. So how are they going to be vaccinated on time? Now, if this is done, we can stem this tide. We can prevent the spread of infection to others.
So you are talking about the response now.
Yes, response.
Emergency response.
Yes.
How do we, once a case is noticed, it should trigger something. It should trigger the Do we have that? Are those kind of a thing? Are they in place? You know, should we make them in place? Where, I mean, will you suggest that an IDP center, for instance, should have an effective emergency response? if one dies, we should suspect that more can come.
Yes, that's what I'm emphasizing. A situation whereby it takes a while before government, there is an inertia. Something happens before a response is triggered, it takes a while. It affects other people. But let's imagine there is already a structure on ground. If this happens, what do we do? It makes response is very, very prompt.
Yes.
Thereby, we can prevent the number of deaths that result from such cases.
Now, Doctor, we spoke earlier about ignorance, lack of awareness, you know, even of basic hygiene. Even in a place like the IDP camp, for instance, nothing stops the environment from being clean or the people from knowing what to do. Now, how do we get information about these common practices, good practices? How do we get it across, not only to IDP camps, but to the generality of the public? Information is key.
Let me take us back to the Ebola period. At that point in time, you wake up at 5 a.m. in the morning and see a text message from your auntie in the village or from your mother in the village telling you, wash your hand, use salt, you know, some of the myths that were going around. Now, I believe if a situation is dire enough, we can respond to it properly. Everybody knew at that point that we had to wash our hands. Everywhere you go, somebody's carrying a sanitizer. Everywhere you go, somebody's carrying a bar of soap. You wash your hand. You don't want to catch Ebola. It's the same thing with all these diseases. For cholera, for example, it doesn't matter where you are, in your office, in an IDP camp, wherever. Once you use the toilets, you know you have to wash your hand. Now, let me give an example. Measles has a vaccine, which is given to children. Now, in the last immunization. Now, since March 2018, according to the Nigerian Center for Disease Control, we've had about 605 suspected cases of measles in all 36 states. That is a lot for a country. Now, that goes to show us that very few mothers are immunizing their children. But just like you said, information can be passed. If we are in the South, for example, we want to pass information from the Ministry of Health to these people. We do it in their local language. We do it through their village chiefs. We do it through their husbands. You know, people that are close to them that they will listen to. If we're in the North, we do it through their local language, through their ward chairman, whoever is an authority figure in that environment.
Now, the program is Nigeria Today. We're taking a look at the outbreak of measles and other communicable diseases, especially cholera. Now, we went out earlier in the day to take aggregate opinion of Nigerians as to how much do they even know about these diseases, how to prevent it, and what to do in case it knocks. We'll take a short break and we'll take those clips.
If it is measles, it's better you have a very good house that has a cross ventilation so that you minimize the heat, especially at this time now. And then for cholera, you have you try to have a preventive measures like washing of hands, and then and also early detection.
Cholera, I think it's excess of water. Though I'm not a health person, so I don't too much have idea about it.
I don't know actually where it happens, but as I heard of YOBE or somewhere else, I don't know. But I think if government will provide medicine, then it will preempt the disease from affecting other areas.
People should disease a situation whereby they should be sleeping almost 5 of them in one room without maybe window or fan or AC, because they need ventilations. That is one. 2, if you want to eat, you should wash your hand and know the kind of food you're eating.
Welcome back. Voices of Nigerians there. It doesn't seem that the information is not out there. Nigerians do know to some extent what we're talking about. That's good. Now, but in case of an emergency, maybe a mother is suspecting that this child is running temperature unabating, and then maybe stooling or vomiting. And what are the signs that can make the mother to know that there's a problem, and what are the prompt actions that must be taken?
Okay, let's take measles for example. A mother notices that most of the time, the first thing that the mother may notice is fever, just like what you said. The child will be running fever. The other accompanying things that will follow it, the child may also be coughing. The child may be what we call coryza. The child may be running nose, sneezing, and the child may also have redness of the eye, what we call conjunctivitis. Now, when the mother notices this, you know, when the mother notices this, and the mother discovers that most of the time the fever is high grade, it could be the body is very, very hot. Now, such a mother should actually visit an health center. Okay. But if such a mother does not visit an health center all the time, then rashes most of the time. By the time you are getting to like 3 to 5 days, rashes begin to appear. And most of the time, the rashes start to appear from the hairline, from the head, from which the rashes will now spread all over the body. So now, before the rashes will come out, if the mother take the child to hospital, though most of the time we all know that measles is a viral infection. By the time disease cascade has already been set up, there is practically nothing you can do. That is why the key thing here is that prevention is actually better than cure. Because by the time the cascade of disease are already set in, it will run its course. Okay. So we expect that a mother who notices all that to take the child to the hospital. Okay. Now, what we fear most is actually the complication. And this happens more. That is even why the high BP issue now becomes a pathetic case. In a situation whereby the immunity is very, very low, people are not feeding well already. A child now has measles on top. It means that the complications that will result from that simple measles, which a child who is well fed may be able to fight. The measles will just come and run its course, and the child will be fine. But a child who is already in a bad state, so to say, can develop all those complications, can have a bronchopneumonia or pneumonia, can even go blind, can even have a deafness from as simple as the measles is. So we can see the complications, can have a encephalitis, can begin to convulse.
What is okay.
Encephalitis? Encephalitis simply means inflammation of the brain. Okay. Inflammation of the brain. Okay. Now, okay.
Doctor, yes. Like we are watching a football match. Okay. Everybody is a coach. You should have done it that way. In this situation, some people will tell you, don't worry, the child is vomiting. Don't worry, something we can take care of. Just take this. To what extent is self-medication in taking care of some of these diseases causing a problem or even solving the problem?
Cholera is a very good example of what you're asking. Now, someone comes down, someone is infected with Vibrio cholerae, which is the bacteria that causes cholera. First things first, start vomiting, start stooling. You notice that the stool looks like rice, what you call rice water stool. Now, in the home, before you get to the hospital, of course, you'd have vomited a few times. You'll think, oh, he just ate something, it's food poisoning, it will go. The best thing you can do for that person is to give the person ORS, oral rehydration therapy. That can go a very long way in saving that life, which goes to talk about the solution. Now, most times we fail to realize that some of these things need a clinical eye, meaning they need a medical doctor to give us a proper opinion on what is going on. It might just be beyond stooling and vomiting. Measles, for example, can just be beyond catarrh, cough, fever for most children. You know, the mothers from the village say, don't worry, it's just catarrh, it's just cough. But it's something more than that. Now, it's important to do two things. give first aid in the home if you can, or if you have any knowledge of it, especially when it comes to oral rehydration therapy. In all these disease groups, dehydration is very dangerous. It can kill much faster than anything.
Okay. So
water is very important. And then the second thing that needs to be done is to get that person to a health center as quickly as possible.
Can someone outgrow measles, for instance? People will say, it's not the disease of an adult, or once a child reaches this age, you cannot have measles again.
Measles actually confers immunity. Once you have it once, more often than not, you can't have it again. Now, from the mother to the child, it confers immunity as well. But after 6 months of life, when the fetal blood, it's called fetal blood, has left that child, then the child can now have measles, because his baby blood, in quotes, has been replaced with adult blood, hence the need for immunization. Now, there's another myth that we need to debunk. Okay. Measles actually affects more than two types of people: children from 5 and below, and adults above 20 years old. It affects pregnant women as well, and just like my colleague said, immunocompromised patients.
Okay.
Patients with HIV.
Before you start your highfalutin, let me just stop you. Now, doctor, from what we read, from what we're hearing, there is measles in the IDP camp. And like you said, that is volatile. What will you advise should be done? As we're speaking now, what will you advise everybody to do as emergency so as to halt the outbreak and deaths?
Well, first and foremost, enlightenment is very crucial. People should be enlightened about what is currently happening in the camp. And after proper enlightenment has been done, you talk about the first aid. Most of the time, the fever, as I said initially, the fever is high grade. People should be taught in order to, what can they do at least to bring the fever down. After which, then the health facility in the camp, then the child can be taken to that place. Okay. Then they will go ahead and address other issues.
Yes. Finally, on the program, well, thank God many are not in the IDP camps, but they too are prone to having this kind of complications. What will you advise in the homes so that especially those that run the risk of cholera or measles?
Just like one of the respondents said on the Vox Pop, it's important to live in a well-ventilated space. Sanitation is key. Sanitation is very key. It can be the difference between life and death. Just take a few seconds to wash your hands. Whoever is cooking, whoever is handling food in the home must ensure that they observe the highest level of hygiene within the home. The plates are also important. Now, we need to mention that where you store your food is also important. Lassa fever is also on the rampage in Nigeria. Yes. We've had about 8,706 suspected cases already, with 400 dead. And those are the ones that we've confirmed that they are positive. So it's important that we take care of our environment, take care of our homes, ensure that we don't have an environment where rodents can make their own home. So what I'm trying to say is hygiene and sanitation is key.
Okay. I must thank you, doctors, especially Dr. Adeoye Alabi, for all that you've said on the program.
Thank you very much.
Thank you for your insights. And our own doctor in the house, Ayo Olusonya David, thank you also for your comments.
Thank you very much.
Yes. This is where we call it a date on the program, Nigeria Today. We've been discussing the outbreak of measles, especially at IDP camps in Borno and some other states. We shall be back tomorrow with yet another topic on Nigeria Today. Till then, I am Shogun Jeladi. Bye-bye.